So let's say you're in a severe car accident and you have a traumatic brain injury and you're really having a hard time regulating your emotions, right? You just feel like you're crying all the time and you're very distressed. What our program does specifically is uses interventions related to emotion regulation.
Being able to be integrated into a hospital setting is just such a great opportunity because we are the first organization in the nation to provide bedside counseling to patients and caregivers who have experienced a traumatic injury.
In our first 6 months, we assessed 617 patients, and what we found was that roughly 65% of them met the criteria for acute stress disorder, which is huge. When you think about that, you realize that not only do they need mental health services, they need it immediately. So they need it immediately following their accident or injury. If you can provide that kind of Band-Aid and that kind of triage immediately, you're preventing days, weeks, months, years of suffering.
They receive this safe and non-judgmental space to just talk about some of their feelings and stressors after experiencing a traumatic event or a traumatic injury. They also learn different coping skills to cope and manage the stress that comes with healing from a traumatic injury.
It really kind of a big part of it is meeting the clients where they're at, whether it's a patient or their caregiver. So that may mean, we're gonna sit down and talk for 30 minutes to an hour. It may mean we're gonna bust out some markers and paper and we're gonna color about it.
A lot of families haven't even been able to bring themselves to talk about the traumatic event whatsoever. So having someone come in who's professionally trained to say, tell me what's going on. Tell me how you're feeling in this moment, because you're saying I'm good, I'm great, I'm fine, I'm fine, I'm fine. I'm here to allow you space to be honest with yourself and with me. And I find that a lot of patients and families feel like that's a huge relief for them.
My favorite part about working with Miss Sydney is she is so fun and she is so nice. She started to give me some stuff that made me feel a lot better. We made a birdhouse and we also wrote some stuff on a piece of paper and we put it inside the birdhouse.
They're here receiving the physical care, and so we're walking alongside them, helping to heal those emotional wounds simultaneously.
Well, it was really good because I was able to talk, let things out, the things that I was holding in, and I felt really comfortable with talking with them.
And she loved coming to therapy. And when she gets back home from therapy, I could see a difference in her.
We only see trauma patients, so right now we're kind of pigeonholed into that one area of patients who need us tremendously, but I would love to see it expanded to different kinds of patients because we know chronically ill patients also need a lot of mental health resources as well.
H2H has already revolutionized pediatric mental health in that we created a new standard of pediatric mental health care. Once hospitals learn about our program, they see our data, they see the success story of Bonheur, I believe that more hospitals will want to implement the model and have a success story similar to ours.